Hey everybody, thanks for joining us for today's ClinicTracker community training series. This is Alicia. We'll be starting soon. We're just letting people get logged in now. Thanks, Jackie, for your question. While we're waiting for people to get logged in and situated, Jackie's asking, are we going to be able to record this meeting so she can watch the whole thing later? The answer is yes. All of our webinars are recorded, and we post the webinar recordings on our ClinicTracker community training series page. You can access them from the user portal in the upper right-hand corner of the ClinicTracker main screen. Okay, so in the upper right-hand corner, there's a user portal where you can find the ClinicTracker the user portal link, and then you'll see the webinars right here on the left-hand side. Okay, that being said, I think most people are logged in, so we'll go ahead and get started. Again, my name is Elise, and I'll be taking you through today's topic, which is how to leverage workflows for your day-to-day activities and compliance requirements. So we're going to walk through how the system can create due dates and automate some of the tasks that you need to do on a day-to-day basis. Okay, some of those tasks might include things like sending paperwork out to the client through the patient portal, even creating the patient portal account. It might be creating a due date for the staff member to complete a custom task or a piece of paperwork. We might want the system to email someone. So we'll walk through some of those options today, and we'll take your specific questions. Okay, before I dive into that topic, I do like to remind everybody why we have these webinars. We're making sure that you have access to product experts like myself so that you can make the most out of your ClinicTracker and billing tracker systems. Toward that end, we do record these webinars and post the recordings, as I was mentioning earlier. Those recordings can be shared with your staff if you think they'd be helpful for additional training. We also take your webinar suggestions. We want to make sure that you're getting the information you need. So if you do have webinar suggestions, please feel free to submit a support ticket with those suggestions so we can get your ideas on the schedule. As I'm going through today's topic, it's really important to me that you ask questions so that you get the information that you need. You can ask questions by typing them into the questions box right there in the GoToMeetings panel. You can also raise your hand if it's easier for you to just speak your question and we can talk it through. I'll unmute your microphone if you raise your hand. Okay, that being said, we'll dive into today's topic. Everybody should be able to see the ClinicTracker main screen. Awesome. Okay, we're going to dive into the workflow builder. And again, this is an automation tool that we use to create tasks for either the system to complete or for your staff to complete. Right? That tool is available here under Utilities and then Workflow Builder. Okay, before I go into this tool, I do like to show you how you can grant access to your staff members so that they can access this tool as well. Okay, so if you're just starting out and you need to give someone access to this tool, you'll go into their staff record by going to Staff and then Staff Info. This is where we're granting all of our system permissions. In the Staff Info record, this is where we're doing the Find Form button. So it's right here, this binocular button. And then we can type in our username. So if I type in my last name, I can double click my record and go to system permissions. Okay, for the workflow builder, this user does need to have administrative privileges. So in order for me to access the workflow builder, I need this box checked right there at the top. Okay, once you grant that access, the user will most likely need to log out and log back into the system in order for those changes to take effect. Once they have administrative permissions, they'll be able to come in here to the workflow builder. Okay, any questions so far? I'm just going to pause. Okay, I don't see any questions, so I'm going to keep moving. We've entered into the workflow builder, and I have a couple templates set up here so that we can use them as an example. Okay, so the first template that I have here is that on a new registration, okay, here on a new registration, when a form is, when a demographics record is created, then we want the system to automatically create the patient portal account. So I'm going to walk you through what I've created here so that you can see as an example. Okay, so I've just named my workflow so that I can find it later. Okay, and I put a 1 here because that just tells me that's kind of the first step in my flow. Okay, then I can say which form in ClinicTracker kind of makes this automation happen. So like I mentioned, we're saying a new registration. That's a new record that gets entered onto the ClinicTracker demographics form. So that's where a new client record starts. That new client record could either start by somebody calling in and your staff entering information into the demographics form, or it could be through your patient portal and perhaps a probation officer sent in a referral, perhaps a patient self-registered through your website. All of that information goes into our demographic form. So that's what I selected when I said which form should this workflow be based on. When a record gets created here, that's what's going to make anything happen in my automation. Okay, so you'll notice as we go through some separate examples that we have different options once we select a form. So in this case, we're saying when a demographics form is created, but we also have different options like readmitted or switch from active to discharge if we want to make a due date for a discharge summary. Okay, any questions so far on triggering forms? Okay, when we're thinking about the triggering form or which form should this workflow be based on, what we're kind of thinking about is where in the system am I working or is my staff working? That's the form we need to select. If you're questioning which form you need to select and you want to talk it through with one of our experts, you should let us know and we'll be happy to schedule a time. Okay, or you can let me know right now and we can discuss it. Okay, on that form, oh, great question. Thanks, Ken. So one of the questions we have based on staff admin, just to back up a little bit, when I was granting the administrative access to the staff member, they only need that to access this workflow builder in order to create the rules. The tasks themselves will go into a utility that all of your staff can access without administrative privileges. Thank you for that clarification. Okay, just coming back in, we talked about triggering form. I'm mentioning that there are different actions you can select in order to have that, in order to have this workflow be started. Okay. If that action happens multiple times, we need to tell the system what to do. Should more than one task be created? In our case, we're saying no. But you'll also see, if it's a nightly automation, perhaps we're seeing that a task was already created, but now it's been past 20 days, so I want to create another one. Okay, or I can just prompt the user each time. So there's some different options there. Take a look through. We can also see that this workflow is active. So by default in the system, this workflow is going to happen. If you want to leave this off until you're ready to test, you can say, no, this is not active. Or you can put in rule effective dates. These are totally optional, but they're very helpful as things are changing, especially around telehealth requirements, that kind of thing. Okay, the next button allows us to say only one task needs to be completed. We're going to talk more about this in just a few minutes. So right now I'm going to move right down to add filter. Okay, you'll notice that this item does not have a filter. If it did, it would say edit filter. We're not going to filter this particular workflow. We want this to happen for every single client that comes in. But perhaps in your clinic, you only want this to happen if the client is an adult. If it's a child, you do not want the patient portal account to be created automatically. If that's the case, you can come in here and filter the workflow based on information in that patient info or demographic screen. Okay, so I can look at this drop down and see what my options are, and you'll see that it's everything on the demographics form. Okay, so I can filter this workflow based on anything in that form, including the age. So I can say if the age is greater than less than 18, then we're not going to do this. Sorry, it would be greater than 18. So we're going to say only do this if it's greater than 18 and then save. Okay, so that's going to add that filter right in. Now, if you add a filter by accident, or like in this case, we don't want to keep that filter, you can come in here, double click, delete your filter, save, and it will close for you. Okay, so now that filter is removed, and you see that that button changes back to add filter. Questions on filters? Okay, we're going to walk through a couple more examples, and we can talk through filters if you have any questions. Okay. Once you have your filters created, that's when you can really save your workflow and come over and start adding tasks. So you'll see that I already have a task added. I got that in there by pressing this add task to complete. Okay, this is where we can click edit and see how the task is configured. So once again, I've named my task something that I can find later. Okay, and then I chose the type of action that needs to be completed. So you'll notice that there are 3 types here: form actions, custom actions, and smart flows. Okay, so just to give you a breakdown, a form action is something that your staff will get a due date for. So locking of a form, creating of a form, that kind of thing. Okay, next you have a custom action, which is just a task that you type in and you assign it to your staff. Okay, and you can put in details over here. Last, we have a smart flow. A smart flow is an action that the system is going to complete for you. So in this case, we chose a smart flow. Then the top drop down says custom workflow, and the bottom drop down says create patient portal account. Okay, so that's going to go ahead and create a patient portal account for the client. Okay, that next section, we need to identify when this happens. Okay, so in this case, we're saying the automation happens within 1 hour of the demographics form being created. But I could wait and say, well, that's going to happen after the client is actually admitted. I don't want to create a patient portal account until I know they're going to be admitted. So there's some other options here, and they're pretty self-explanatory. So we're going to come right down here to say, if the due date falls on a weekend, what do we do? Do we leave it as is? Do we push it to the Friday before or the Monday after? Okay, so in this case, we'll say leave it as is. The patient portal account automation can happen on the weekends. That's fine. Okay, next we're going to skip right down to the bottom and say update. That adds the task here. So the question is, if I want the task to happen instantly, do I want to put 0 here? Okay, I don't recommend that because if the patient portal account gets created, or sorry, if the demographics record is created, let's say somebody's entering it on the phone and they save it and then they add in the email, then you would have missed the patient portal account going out to an email on file. So having it an hour out gives that front office time to make sure they have the record completed before that automation is run. Good question. Thank you. Okay, any other questions on creating that original task for creating a patient portal account or just creating tasks in general? I'm not sure that 0 is an option. Let's just give it a go. Yeah. So we do have 0 there if you do need to have it be instant. Again, I wouldn't recommend that for patient portal account. I would give it an hour just to give your staff time to make sure the record's up to date. Okay, let me know if there are other questions here. Creating a patient portal account is generally the first step in the patient's kind of engagement journey is getting this account created. Okay, next on new registration, and you'll see I'm skipping to where it says 2. And coming right over here, template new registration on demographics 2, this sends the welcome package. So we have the same triggers, the demographics on creation, no filters, but this time the task is a form request to both the patient and any external proxies. So let's say I take the registration over the phone and I add mom as an external proxy. Okay, so that means that mom has her own patient portal account. That patient portal account has access to the child's account. In that case, this form request is going to go out to both mom and client. Okay, and you can see here's the template. This is my welcome package. This is my specific custom form. Yours may be different. Okay, you'll notice that that happens 2 hours after the timestamp of the creation of the record. So I've kind of staggered the portal account and the form request. Right, and then we left the same, left the information the same. But this time where it says who is responsible for this task, we have the intake clinician. Okay, so what this means is if the client doesn't complete that welcome package, we're going to ask the intake clinician be responsible for following up with the client. Okay, and we want to say that this is going to be due 7 days after the request is sent. Now, yours may be 3 days. If you're seeing the client within 48 hours, you may say 1 day. Okay, now if I discharge the client, I don't need the intake clinician to follow up. So let's say, you know, the client calls and they say, never mind, I'm going to get treatment somewhere else, and I mark them as discharged. That will get rid of this task for me. I don't need the intake clinician to follow up on this welcome package. Okay, now some of you need your welcome packages to repeat every year. Okay, so every 365 days, I need this welcome package to happen again with this client. Okay, so right here at the bottom, this is where I can use the calculator button to say a reoccurrence. So I can say based on the creation of the demographics, or I can say based on the completion of the first welcome package. Whenever the client first completes it, then 365 days later, I need to collect a new one. Okay, and for those of you who are in the states where you need to collect them every January, regardless of when they were originally collected, you can do yearly and say, you know, they're due every January 31st. Okay, questions on reoccurrences? Okay. At the bottom here, you can say when the reoccurrence ends. So most of the time we say it ends on discharge, but sometimes you're in a series, like a rating scale series where I collect 6 rating scales over a period of time. So I would want to end the reoccurrence after a specific number. So that's a different kind of scenario. Questions at all on reoccurrences? Okay. Okay, so we'll save our changes there because we did add the reoccurrence. Any questions on this workflow? Okay. Any feedback? Does anybody think this is going to be helpful to them? Save them time? Anything that you want to make sure we cover in this webinar? Now's the time to let us know. Okay, so we're starting to get some questions. Amber's asking, do we have a list of workflows and smart flows for clinics to reference or get ideas? So we're publishing these templates over the next few releases, but we are walking through them now. And if you did want to copy them or have us copy them into your system, you could let us know. Okay, I'm going to keep moving to the new registration number 3. This is a nightly automation. So this is a newer feature that's available where we can check for missing information. Okay, and then I see one more question before we go. Are you notified if a workflow doesn't run? So I'm not quite sure I understand the question, but I'll try to answer as best I can. If the system has a workflow that is assigned perhaps to somebody, maybe there it references an assigned clinician, but there is no assigned clinician, we can make a nightly automation to kind of assign those tasks or assign a task to a manager to review. So let me know, Brooke, if that answers your question, but I think you may see your answer in this next example. Okay, so for this next example, excuse me, I just want to explain the background. So if I have a clinic who is taking registrations on the phone, getting them through the website, taking faxes, getting emails, carrier pigeons, all kind of things to take registrations, we're trying to take them as quickly as we can with as minimal required information so that we can get people's information in the door. Okay, and then once we have that information, we want to evaluate it and see who needs additional information collected before their first appointment so that our client engagement team can reach out to them to fill in the missing info. Okay, so that's kind of the use case here. So just again, to summarize, I need to check all of the registrations that come in for missing information and assign a task to somebody for follow-up if there is in fact missing info. Okay, so I'll walk you through how to do that. Again, this is a newer feature, so you probably haven't seen it in prior webinars. Okay, so here we've just named it. Moving on, the triggering form once again is demographics. This time, instead of on creation, we're choosing this new option for nightly automation. Okay, if the action occurs multiple times, do we want duplicates of the task to be created? So I'm saying yes. If somebody marks the task complete today, but they didn't really fill in all the information and the automation runs again tomorrow and sees the missing information, I do want a duplicate task assigned. Okay, but if the first task is still active, somebody just hasn't gotten to it yet, then a new task won't be assigned. That old task will still persist as long as it's active. Okay, questions there? It's pretty straightforward. Awesome. Okay, moving on, you'll notice that we do have a filter here. So we're starting to filter for the missing information. So this time we've used the formula builder instead of that simpler view with the drop downs. Okay, so this is where we've come in, and the development team has nicely given us a formula sample that looks for missing information, and you can see the missing information it's looking for right here. So the date entered is less than 30, so you can see we're filtering for less than 30. Date of birth is missing, address, insurance, etc. Okay, if the filters are met, then this task will be created. So meaning if the information is missing, we're adding a custom task. So this is a custom action to fill in the missing information. And I can provide additional information over here about specifically what is required. Okay, you're noticing here, instead of adding a due date on the weekend, I am pushing to the following Monday. And here, Victoria, this should answer your question. When I pick a responsible staff, I can pick a group of people that I've set up. So in the maintenance menu, you can set up groups of people. Anybody in that group can complete the task. So everybody will see it. If Victoria and I are in the same group and I complete it, it will also complete it for Victoria. If it were to be that Victoria and I both need to complete it, we need to choose multiple entries instead. And then we would choose both of our names. Okay, let me know if that answers your question, Vicki. If not, I'm happy to discuss further. Okay, so speaking of those groups, let's talk about that. You'll notice that I did have a group selected, and that is the client registration group. Thanks for confirming, Vicki. Okay, the client registration group was set up by going to utilities and then maintenance. And in here, I'm just going to type in the word group. Lots of handy groups in ClinicTracker. At the bottom, you're going to see two in particular. There's a form group and staff group. Right now, let's talk about these staff groups. Okay, here's our client registration group. Okay, I just name the group and then I can add in the users here. Okay, so now this allows me to reference this user group from multiple workflows, and I can have in 25, 30 workflows that all go to that client registration team. Next time I need to assign tasks, I don't need to go into 25 to 30 workflows and add in my new front office person. I can just come in and add them to this group. Okay, and once again, this is saying anybody in this group can complete the one task. Okay, while we're here, we'll talk about the form groups. Okay, when I double click here, you'll notice that I do have some form groups created already, or I can create a new one over here. So the action to complete, we have things like creation of any of these forms, locking of any of the forms selected, sending form requests through the patient portal, both to a patient and external proxy. Okay, when I pick these, you can see I have an example like locking of any progress notes. So I have all of my progress notes selected. Now I can say if a client showed up to an appointment, the clinician who is selected there just needs to lock any of these progress notes. One of any of these. Okay. If there are any questions, let me know. Okay, and we'll go back over to the workflow builder. Okay, so we, once again, just to remind you, we use that workflow group right here to say who is responsible for this task. So it's going to be Alicio or that end user, because that's who's in that client registration group. Okay, now notice that I'm not reminding the client registration group in their message board that this task is coming due. Okay, but if I wanted to remind them to say, you know, this task is due, log into your staff task dashboard to see it, I could put a number here, and that's going to create a message in the compliance alert section of these users' message board. So just going back to the main screen, that's right over here. They'll have a compliance alerts box where they'll see a message about their task. Okay, I really caution on overusing the messages, right? Because our end users are having a lot of traffic going back and forth all day. So if we're putting a lot of messages there, they're kind of going to start to ignore them. So I definitely recommend using some judgment about when we're prompting the users in their message board or not. Okay. Just coming down here, we're going to go ahead and click Update and Save. Okay, any questions on this nightly automation that checks for missing information on the demographics? Questions on staff groups or form groups? Does anybody have a workflow from new registration, the time that they grab a new client, to now that they'd like to talk about before I move on? So when you first get a new registration, a workflow we haven't discussed that you need to talk about before you move on. Hands up, questions? Okay, I don't see anything, so I'm gonna keep moving. And we're gonna come down here to some more examples, but this time it's gonna be based on the appointment details. So we're moving into when an appointment actually happens. Okay, so with the appointment details, we have it named the way I kind of suggested, where I can find it later. Next, I'm choosing which form this should be based on. So the kind of custom label I've put in my system is the appointment details, but this is when I'm entering in an actual appointment record, saying when that appointment record is updated. So this time, instead of on creation, I'm doing it on update. Okay, and just to skip down, I'm filtering this further to say, this is only going to happen when the status is equal to showed up. So that's why it's on update, because initially the appointment is going to go into a pending status. And if I say on creation, but the status equals showed up, then this rule would not trigger. Okay. Instead, when the appointment record is updated and the status equals showed up, then this rule is going to be triggered. But notice, we're not going to duplicate any of the tasks. So the first time the task is created is going to be the last time it's created. You can continue to update the form after that. So add in your authorization, change the CPT code. You're not going to get a million tasks. You'll just get one because you selected no under duplicate tasks. Okay, to take it one step further, I filtered it to say if the service name is the health behavioral assessment. So this specific code requires a specific progress note. Okay, it can't use any of those progress notes like we saw in the form group. It has to use a specific progress note. Okay, so in that case, we're going to come over here to where it says complete agency intake. Okay, so what I'm saying is we need to lock, and in this dropdown, we'll select the agency intake. So I'm just pressing F2 and looking for my progress note template intake assessment. Okay, and I can say that this is due within 48 hours of the appointment detail, so the 48 hours of the appointment date. Okay, and it's going to be due from the record-specific clinicians, whoever the clinician is on the actual appointment. They're going to be responsible for locking this progress note within 48 hours. Okay, Next, let's just say this biopsychosocial is due 5 days after. Okay, so after that initial appointment, there's this larger form that the clinician needs to enter. So we're going to say that's due 5 days after the appointment. Okay, again, we're going to say that's whoever the clinician is on the appointment. Okay, and we'll save our changes. Any questions on making a specific workflow for a specific service type that requires a certain progress note? Okay, if you have workflows based on certain appointment situations that you want to make sure we cover, put them in the chat now so I can make sure. Otherwise, we'll just keep moving to number 2. Okay, this is a different type of appointment. So I'm saying complete the diagnostic eval or the biopsychosocial. So I kind of had this one started based on the appointment detail on update. We're saying again if it showed up, but this time we have different services. So it's one of multiple entries. So I'm just clicking into the service. Service name includes multiple entries. And I selected these 2 diagnostic evaluation codes. Okay, for these specific codes, they require a diagnostic evaluation or a biopsychosocial. Okay, now in here, in the task, what I have is, where it says locking of, I've selected a form group. Okay, and if you remember, the form group says locking of any, and in that form group, I have diagnostic evaluation or biopsychosocial. So the record-specific clinician is going to be able to complete either of those items that are in the form group in order to make this task complete. Okay, questions on that? I'm just going to change the name while we're here so it matches up. Okay, and I just recommend that you do the same so you can kind of find things later and it makes sense to your clinicians. Once again, if you need to remind them in their message board, make sure you put a number in here. Otherwise, the task is just going to show in the task dashboard. Okay, we'll save our changes and keep moving. Remember, if you have any appointment-specific items that you'd like me to walk through, certainly let me know. Okay. Another template that we have here, showed up appointment, system checks for nightly missing progress notes. So again, this is a nightly automation, but this time instead of the demographics, it's going to be based on the appointment details. So nightly, we're going to look at the appointment details records. So any appointments we're going to check. Those appointments are going to be where the progress note is missing and the appointment was in the last day. So we're only going back a day. And we're looking at only showed up appointments. So you can see these filters here. And you can edit these if you need to say, you know, if you want to go back 30 days, you can do that too. Okay, in this case, it just goes back 1 day. And then if the progress note is missing, we're creating a reminder to the clinician. Okay, so a lot of times the clinicians are just used to doing their progress notes every day. We don't necessarily want to give them a task to say, here's every appointment, and here's a task for a progress note. We just want to trust that they're going to get it done by the end of the day. Okay, so this option allows us to just now go and check and say, well, by the end of the day it wasn't complete, or by the end of the next day it wasn't complete. So now we're going to give them a task to remind them, hey, this appointment was done, but you don't have a progress note entered. Okay, so this is an alternative option to having those specific progress note due dates for each appointment. Any questions? So we'll go through creating a workflow from scratch. That workflow can be based on our agency assessment or one of our custom forms. And we can filter it to say if a certain condition exists on that custom form, then something else happens. Okay, that might be like on the intake assessment. If I indicate, yes, this client is going to be admitted, then I want a program assignment to become due. Okay, in order to accomplish that, I need to make sure I have the correct field on my form. So we'll take a look at our triggering form in the form builder. And we'll just take a look here at the intake assessment. Okay, and you can see we have some fields here, just some sample things. And at the bottom, what I'll do is I'll just add a checkbox that says this client is going to be admitted, just for our example. Okay, and just to make sure the database is updated, I'm just going to push this little refresh button so that I can make sure that the database updates right away instead of waiting a few minutes for the process to run. And it just updates things behind the scenes, and I'm closing out and going back to the workflow builder. Okay, so utilities, workflow builder. I made sure my source form or my triggering form had the field I need to filter. Okay, so we're going to say on the intake screening, admission is yes. And again, I'm just going to put a number so I can keep track. This is the first in a sequence. Okay, which form should this workflow be based on? Well, you saw what I just did. It was the intake. So I'm just going to type in intake here. There's that intake assessment example. And we can say, once again, on update. So at any time, the clinician can keep saving and saving and saving, but it's not going to trigger this workflow until that checkbox is selected. But once that checkbox is selected, they can keep saving, and additional tasks will not be created because I'm going to put a no here. Okay, coming right down here to the filter, I'm going to switch over to form info, use my drop down, and this is where I'm looking for my checkbox that I've added. Will this client be admitted? Okay, if the field was just added, you may need to log out and log back into ClinicTracker in order to see those changes. Okay, but this is where I could filter it to say, the client is going to be admitted, and then add in my additional tasks over here. And we'll say we need the creation of a program assignment. So we could say that that happens within 1 day, or we want to say within 3 days of the first showed up appointment. Okay, once again, we're going to say that that is the record specific clinician. In other words, the clinician that is on, that is saving the form. Sorry, I got tongue tied there. So who is responsible for this task triggering user? That's the record specific person who's creating the item. Okay, this one you may want to remind them on their message board, just, hey, you need to create these program assignments. If the client gets discharged or changes facilities in the meantime, we can say that this task no longer applies. Okay, and we can add this. Okay, maybe we have some other tasks that we want to put in, like create a staff assignment. So once again, this is creation of, and then the staff. And we can say 2 days after the time of the record, triggering user, and then add. Okay. If in your clinic you only need one or the other, so you either need a staff assignment or a program assignment, we can come over here and use this handy checkbox that I skipped over earlier. Only require one completed task for the workflow. Okay, so it's saying either one of these can be complete. Okay, and then we'll save. Let's take this a little bit further and say, well, if the program assignment isn't created and the staff assignment isn't created, then I really don't want the end users to be able to lock a progress note. They can still create it, but they don't lock it and it can't be billed for. Okay, so that's where I can come over and use this Add Restricted Forms button. Okay, so now I can say, instead of Prevent from Saving, switch to Prevent from Locking, and then go down and select any of the progress note forms and say, none of these can be completed until a staff assignment or a progress note, or a program assignment is created. Okay, any questions on this restricted forms? Okay, we're getting close to the end of our scheduled topic, so any ClinicTracker or Billing Tracker related questions, go ahead and start typing them in or getting them ready now. Okay, and we'll open the floor for any questions related to today's topic. So any specific workflow questions that you have, any specific workflows you need to talk through while we have the time together. All good questions so far. Please don't be shy. The questions are certainly helpful to everybody. Okay, I don't see any questions about today's topic. How about any ClinicTracker or Billing Tracker related questions? Oh, Brooke, this is a great question. I'm so glad that you asked this. How do you recommend that you test a new workflow? A really great idea is to use this filter. Okay, so you can use a filter to say, if the client ID is XYZ, okay, and you can have a test client or several test clients with the client ID test, okay, or you could say contains test, and then you could have test 1, test 2, test 3. Then the workflow is only going to apply to those specific clients as you work through, okay, and you can check that the tasks are created the way you're expecting for just the clients whose client's ID contains the word test. Okay, and then you can remove that specific filter when you're ready to go live. Let me know if that answers your question, Brooke. So Amber's asking about a current manual for the workflow builder. We're constantly building right now into the workflow builder and adding features. So we're going to keep having these webinars. The next one is going to be on the 27th, building more workflows. We're going to get into building your workflows and get into the specific, the program specific workflows. So today we kind of focused on getting started, what's possible. Next time we're going to start working on actually building, and so we'll use these webinars as the basis for the manual, Amber. Looks like Brooke is good. And then Ebony, you have a form building question. So I'm going to pause and just ask, are there any more workflow building questions before we move over to form building question? Okay. So I'm going to close out of here. We'll go over to the form builder so we can answer Ebony's question, utilities, form builder, form builder. Okay, and I'm just going to pull up a form here. And the question is, how do I pull information from the demographics form into the intake form? Okay, so using the workflow builder, using the form builder, you can pull information from one place in the system to another. And you can take that one step further and you can actually write back. So on this transfer summary, let's say I want to put in the client's name right here. Okay, and I'm just going to say patient name. Okay, and I have two choices now to move forward. I can either pull the client's name forward and leave it there, or I can display the client's name and allow the user to update that name, which would then update the demographics form. Okay, let's actually say patient first name. Okay, so in order to just pull information, we're using a data source. That just pulls information one way forward into your form. Okay, the data source is actually quite large, so we ask that you search first. So I'm just going to type in the word name and click enter. That fills in this drop-down box. Okay, now I'm going to use my F2 again. So I'm using F2 to search any drop-down box throughout the system. And I'm typing in demographics. So I'm looking for the demographics data source. And here it is. Here's the patient demographics. And I'm looking for the patient first name. Okay, this data source, once again, it pulls information forward. It does not write back. If instead you want to use this form to update your demographics record, you can do that using what's called a reference control. So here you can click in. Again, we're asking you to search first, so type in what you're looking for and click enter, then expand the drop down. Okay, and if you're like me, I use the F2 a lot, but you can also scroll down and look for demographics first name. Okay, this is still just pulling forward the information to display, but this next property down is no longer grayed out because I have a reference control selected and it's saying right back to that reference control. So that's meaning anything that's saved in this box, do I want it to write over whatever I initially pulled? So it's pushing back information to this form. I need to say yes here in order for that to happen. Okay. Any questions on pushing information or pulling information using the form builder? Any other system related questions I can answer? Okay, so we have some questions about staff settings. So each staff member will have access to their personal settings by going to Profile in the upper right-hand corner. Okay, I'm logged in as a master admin, but if I was logged in as myself, it would have pulled up my record. And I can go to the Personal tab and switch any of these notifications. So we have things like disable conflict checking, notify me with treatment phases, etc. So you can toggle clinician-specific notification setting here. Global notification settings are found in the options form under admin options. Okay, and this is where you can see all of the notification settings in here and be able to toggle them globally. Okay, next, is there an audit log? So yes, there is. Under utilities, we have view audit logs right at the bottom. So utilities view audit logs, any of your administrators are going to be able to see this. You have access to login records. Specifically, what's being asked about is patient information access. Okay, so I can look back and see, for the last month, who's accessed patient information. That's going to show me the username, the patient, the form. Okay, you also have advanced audit log viewer that's going to show you scheduler information and additional information about client records. Vicki, I think you're right. The scheduling notification is only a global setting. So you can do one of two things. We can either put in a request to have a staff specific setting for scheduler notifications, or we can disable it globally and use the workflow builder to trigger an automation when the appointments are created. Okay, I mean, that's a great idea. Is there a way to have the clients confirm their information in the client portal every time they log in, like email, insurance information? So as soon as the client logs in, have them confirm their demographic information. Right now, there's not a way to turn that on, but what we can do is submit a request to the design team. Is there anybody else that would find that handy, where the client logs in and they need to confirm their demographic information each time they log in? Okay, we have one more vote. Any other votes for this? Awesome idea, Abby, thank you. Okay, I have you down, Vicki, for that feature as well, so I'll add you as a voter. Any other feedback about the system, requests that we need to know about, pain points, anything at all that we need to discuss before we wrap up today? Amber, I got your vote along with your feedback. Thank you. Awesome. Okay, are there any other questions I can answer today? System ideas, webinar ideas? Anything at all I can answer about ClinicTracker Billing Tracker? Okay, next time during the workflow basics, we're going to learn more about triggers, filters, and tasks. We're going to talk more about how the system smart flows can work together, like the appointment automation, the appointment creation automations, the staff defaults, the staff assignment automations, and how they can interact with the workflow builder in order to make your entire operation kind of streamlined. Okay, so we're going to talk more about that. If there are specific workflows that you're struggling to figure out how to put into the workflow builder, you want to discuss on that webinar, please make sure you send them into the support team ahead of time so that we can consider each idea. Okay, that webinar information is in your chat window now. Please make sure that you register and send the link out to anybody that you think would benefit from this information. We want to definitely make sure we have a lot of perspectives as we walk through these workflow examples so that we can get everybody's ideas and feedback. Okay, and just like you saw, Ebony's asking questions about features that aren't there yet, and Vicky's asking questions about features that we don't have. And those are great ideas that we're going to submit to the development team. Okay, so as always, bring your feedback if you're running into a pain point somewhere in the system, and we need to hear your feedback about how to make it better. Bring that over, and we'll talk about it at the next webinar too. Okay, last chance, any questions before we wrap up? Reminder, this will be posted on our user portal, so feel free to send out the recording to anybody you need. Okay, it looks like we've reached the end of our questions. Thanks everybody for joining. I hope you have a wonderful weekend. Thank you so much for your time.